All right. Good afternoon, everyone, on the HHRC podcast. Today we have First of Alameda in the building, and I'm going to let everyone introduce themselves. Without further ado, we have.
Caitlyns Journey. I'm the communication specialist for First Five Alameda County.
I'm Beatriz Dominguez. I am the Child Development Care Coordinator Manager with Help Me Grow at First Five.
And I'm Carla Keener, Director of Community Programs, which includes the Fatherhood, Neighborhoods Ready for School, and Parent Partnership Strategies.
Awesome. Thank you guys so much for taking the time out of your busy schedules, especially you, Carla, you're a director, so we know how busy your schedule can get. Just want to thank you guys again for coming out and being able to share more about First Five Alameda. So without further ado, what is First Five Alameda County and what services do you guys provide? Anyone can go.
I'd be happy to provide a little bit of context about what First Five is. So, First Five is a publicly funded organization. It's funded through a tobacco tax that was passed by voters in 1998. And there is a First Five commission in every county in California. So we work for First Five Alameda County, but every county in California has a Children and Families Commission, which is their First Five. So that's just a little bit of First Five context.
Okay.
And I think it's also important to know that beyond what Caitlin shared as our background and our history, is that First Five Alameda, like every other First Five, is committed to the optimal development of every child so they arrive ready to thrive at kindergarten. So our North Star is kindergarten readiness for every child in our county.
That's amazing. Now, we talk about the three-piece framework. What is the three-piece framework, and what is the commitment to systems and change within building in early childhood?
That's a great question, Robert. I think with our 2022-2027 strategic plan, the framework that we've adopted for this 5-year period is a place, people, policy framework, the 3 Ps. Mm-hmm. Place, because we know the conditions in which children and families live and children grow up has a direct correlation to if they're ready to thrive when they get to kindergarten. Mm-hmm. And people, much like the work that Beatrice and the Help Me Grow program do, is to look at what are the services and resources that folks need to be enlisted in or referred to in order to get the supports they need to make that reality happen. And then policy, because so much of our work and the data that we create or generate does impact our policy and advocacy agenda. So the 3 Ps are linked and are all necessary to reach our North Star.
Beatriz, what is First Five Alameda's goal in your opinion, or in your general aspect? What is their goal?
I think Carla nailed it. I think it's to make sure that every child in Alameda County is ready for kindergarten by the time they reach kindergarten age. I think one of the biggest goals is not only that they're academically ready, with preschool and alphabet. It's that they're mentally and socially, emotionally ready, as well as developmentally ready.
And talking about services, if we can break down your services that you give a child from 0 to kindergarten, how would you break down your services as far as kind of like pillars?
Mm-hmm. I think, again, referencing our strategic plan, we have 6 programmatic strategies. Again, I talked about neighborhoods, which is our place-based effort, fatherhood services, because too often we focus, not intentionally, but has been our history on mom or the mother figure. We have our pediatric care coordination with Help Me Grow and Dulce, which we can talk about a bit later, the parent partnership work, and then I think ECE, the early care and education work. And so those are sort of the foundational programmatic pillars. And from that, we are able to provide us an array of resources, but also not just for First Five. I think as our role as in some way backbone or foundational to the early childhood system in Alameda County, we also partner with, collaborate with facilitate change across the spectrum. So those services and programs that we don't offer are contract out. We are then looking at how do we make sure there's a continuum, a life course that prenatally, the zero, all the way to the child reaches that kindergarten door, and then the important handoff, the transition, are really important aspects of what First Five does. I think the other thing that I didn't maybe mention explicitly, aside our North Star of kindergarten readiness, is our commitment to equity. Because we also have to look at where our most vulnerable children and families are, and how do we allocate resources to lift those who have been the most left out, left behind, and overlooked, to make sure they also arrive at kindergarten ready to learn.
And hearing that you're talking about equity, that leads me right into my next point is I want to know about you guys. I want to know about your guys' journey and how you guys came to First Five. What was that niche or that impact that made you feel like, hey, I want to be a part of First Five and that community and what they do. So we can start off with Caitlyn, and then we'll move this way.
Yeah. So before I worked for First Five Alameda County, and I'm relatively new, I just started in February of this year. But before that, I worked for the First Five Association of California, which is the member organization for all of the 58 First Fives. And they provide technical assistance and policy support and a lot of different things to the First Five commissions. So I came from a First Five background, and then before that, I worked as a journalist, actually. But growing up, my mom was a pre-K teacher, and that is the sort of the main thing that attracted me to my job with the First Five Association, was knowing how she, as a teacher, had worked with First Five and worked with their quality ECE programs, and just knowing a lot about the value of child development and those early years. It really spoke to me to get to be a part of that like foundational work for children.
I came to First Five back in 2004, so it's been a minute. I came to First Five. I had a set of twins that were born at 26 weeks, so they were 13 and a half weeks premature, break down to like 3.5 months. My son spent 3 months in the NICU. Um, when they were both discharged, I learned kind of all of the different systems that I needed to access in order for them to reach optimal development. And I had to do that on my own. And so I relied on just picking everybody's brain that was either giving us some physical therapy or some speech therapy, and just how can I make this easier for somebody else? And when I came along to First Five, I was initially doing some translation work for screening at one of the clinics. And then I stayed on. And my babies are now 21 and soon to be college grads. So it was, I feel it, in a sense, one of the things that I really value and appreciate about my position now is being able to kind of give back a little bit, and also be a personal experience voice for a lot of the families that we're serving.
I have to say, every time I think of your story, Beatrice, I just have to take a moment and just say how incredible the lived experience and what she brings authentically to the folks she works with. And similarly, how I came to First Five was also a little circuitous, that I started with knowing service when I was growing up. Both of my parents migrated here from the South, and so knew inequities and disparities really early, and saw how that played out with my dad's service in the military, and then having a work injury and how he was treated and was not able to access benefits, and then what that meant for my family and my two sisters and myself. And so fast forward, my first two stops in my career were in healthcare. I worked in 2 hospital systems, one in the West Bay and one in the East Bay. And then I worked for a foster family adoption agency where I saw how folks, depending upon either income or insurance or education, how they were treated. When 1998, when Prop 10 was being advocated for in the community, I started going to some of the community meetings. And because I was so concerned with the number of children, particularly Black and Latino children who were removed from care disproportionately than other kids, and I'm like, we can find as many wonderful foster and adoptive parents as possible, but we're never going to get as many parents as we need for the kids who are being brought into care. How do we stop that? The adage of not picking kids out of the river, but finding out why they're falling in. And I saw Prop 10, our first 5, as an answer to that because we focus on prevention and early intervention. And so once it was passed in December of 1998, I immediately started lobbying. I got to get a job at First 5. I don't care what it is. I'm going to work there. And I literally looked for a year before a position came available. And that was September 2001. And I've been there ever since.
That's awesome. And it's wonderful to see, how California's such a mixing pot of just a whole bunch of races, ethnicities, cultural backgrounds, people, religions. It's amazing to see someone, not just a female director, but also a African-American female director. And me personally, it speaks volumes, I'm pretty sure, for the families that are like, hey, this isn't just some guy at the top. It's a woman who knows what I've gone through or who have similarities or things of that nature. And overall, I just want to say I appreciate you for advocating for not just, Black and brown, but for all the women that for sure need help. And then also the father program. I can't thank you guys enough.
Well, thank you. We have a powerful group of folks here, but back in the agencies, 80 some strong now, that all have the same commitment and have incredible stories about why they do the work. So we're really fortunate to be at such a place.
Now, COVID. What was your guys' focus right before that March 3rd date hit on 2020? What was the niche or the main focus as far as, hey, this is what needs to get done before the impact happened?
So I could speak for, as far as Help Me Grow is concerned, I think we were focused on expanding our reach a little bit as far as pediatric clinics, continuing to grow the numbers. As one of the ways in which families access Help Me Grow and the centralized access point at Help Me Grow is through a pediatric referral. So when a parent takes the child to the pediatrician, if there's a question or a concern, the pediatrician can send us the information, and then we follow up with the families. So we were striving to keep that number growing and reaching more families and making sure families knew that there were services available to them, a number they can call where they can get information or questions answered or a resource. As far as Help Me Grow. Yeah.
March 13th, 2020, that day will be blazing in my mind forever. It was a Friday. When we left the office, there was this buzz that something was happening and taking afoot. We came back Monday, the 16th, and literally we had a couple of hours for people to get boxes and to say, we're going to be at home for a couple of weeks.
2 weeks.
2 weeks. We'll see you in 2 weeks.
I remember that conversation.
So we were, to Beatrice's point, we were busy doing what we do, providing services, linking folks to services, doing collaborative planning with sister agencies, public and community, and really felt it was just going to be a slight halt, and we would be back. And that 2 weeks turned into 3 years.
Yeah.
And so I think what we did was we doubled down on what we did and do well, is that we had to make connections. Maybe sometimes they were renewed, or we found new resources, or we had to recalibrate our partnerships. But we never stopped serving, never stopped imagining. And I think specifically to some of the areas that I looked at, we were just getting started and getting traction with our neighbors ready for school, our place pillar of the 3Ps. And those communities, Deep East Oakland, Roots as our anchor agency, Lincoln and West Oakland, San Antonio Family Resource Center, which is a trio of agencies, Tribe, Lotus Bloom, and Ebasi, and then Union City Family Center had to pivot. And they started calling us and saying, play groups are great, but that's not what parents are asking for right now, because a lot of those folks were, essential workers and first responders. People were needing PPE and diapers and food and gas cards. So we had to pivot, but it was still about service and linking and still providing supports to folks. And we actually had to learn more about our own communities to make sure that we knew where some of those resources were that we hadn't previously called upon, like diapers. We became a little Amazon, literally, in Alameda. Our conference center was full of goods that we helped distribute either from our site or to our partners who then took it to their sites to distribute.
Now, on the association side,
Yeah.
how was that impacted?
It's interesting. So the First Five Association actually worked out of First Five Alameda's office. So we're in the same boat in terms of going home. Though, to be honest, I was on vacation on the last day before COVID. So thank goodness for my wonderful colleagues who rescued all of the things from my desk and my computer. But the First Five Association, one of the things that we were working really heavily on was actually census outreach. And that got really complicated, even just when we thought it was going to be 2 weeks, because a lot of our census outreach was going to be on the ground. It was print materials about filling out your census. 0 to 5 is a really undercounted group. Because a lot of folks don't know that they're supposed to count their child, or if their child lives in 2 homes, they don't know which one to count them in. And that's extremely important for resource allocation for the next decade. So that was something that we had to really get creative about. Okay, well, how are we gonna reach these families? How are we gonna pivot the dollars we were going to spend on print outreach that was going to go to the First Five Talk, Read, Sing, Train events? Like, how are we going to take that and transition it into something that's going to work and that's going to be effective? So that was a big change. And we were also, the First Five Association was really focused on telling the story of what the First Five counties are doing. And a lot of the First Five counties were really heavily focused on supply distribution. A lot of them partnered with Supply Bank, and a lot of them were distributing things like diapers and wipes, and also things like cleaning supplies and PPE for early childhood educators. Childcare providers were essential workers, and many of them remained open during even the initial shutdown. But they really lacked the supplies, as we all did. And First Fives really provided that and made it so that it was much safer for them to stay open.
And just to follow up on what Caitlin shared about the role of the First Five Association and First Five California too, is that it was so important to gather data and talk about policy changes that needed to happen. So when you talk about ECE providers who had to stay open, but their enrollments had to be capped, or that was an economic impact to them. So they were working just as hard, but not getting their income. So really collecting data, sharing the stories, and really advocating for policy change around what is an essential worker, what's an essential supply. So there was a lot of that and continues, because people are still recovering in this post-pandemic era, like childcare providers who have not quite made it back 3.5 years later.
A lot of the ones that I went to when I was younger, when I was 0 through 5, they actually shut down because, but this is in San Francisco. They shut down because they weren't able to meet the supply and demand of, hey, these thousands of children need diapers, but we only have capacity to give like maybe 10 families like 5 packs of diapers. So that's amazing to hear that, families, at least on this side of the county, were really able to get that strong and established connection, as mini Amazon was able to deliver deliver the goods to the individuals who really needed them at that moment. Um, what strategies were you working on as soon as you found out, oh, this isn't a 2 week hiatus. I don't know when it's going to end. What strategies did you guys have, or what creative ideas did you guys have? I would say.
I think for us over at Help Me Grow, we had to make a major shift in not our outreach, because at the centralized access point, it's all done over the phone. But we had to switch to more helping families set up an email account so that they could receive information via email, um, texting them materials and, short little links to YouTube videos so that they could see what typical development or social emotional development look like. We shifted from getting a majority of referrals that were about typical development, gross motor, fine motor, language, to basic needs, housing, um, rental assistance. We had families that needed connectivity to WIC or just a food bank. Um, I think the majority of the families stopped going to the pediatric clinics because of the fear of COVID, right? And so the families that were reaching us from either our website or just giving us a call were also looking for resources like, what do I do with my kids at home? I'm trying to work. I can't take them to childcare. Is there an activity or something we can do to keep them entertained or to help them in their development as they're at home? I know a lot of the service providers shifted to doing things like telehealth. They did, speech therapy through Zoom or physical therapy through Zoom. And that was really hard when you have a 2-year-old who is more interested in playing with boxes that are, laying around than sitting in front of a screen for an hour to learn how to say a word. It made it really difficult. So I think we all had to shift a little bit into how we were approaching our work with kids.
So I would say, from what I've gathered from what you said, I would say your reach as far as resources expanded, and it had to expand because they weren't just asking for, oh, how does my child do
Oh
this?
yeah,
It's like,
no.
hey, we need this now.
Yeah.
I need help getting here
Yeah,
instead. So
absolutely.
that's awesome to hear.
Yeah.
Yeah. I think the phrase whole child, whole family, whole community became really evident in COVID because you were servicing everybody in the household
Yeah.
because everybody was impacted with COVID, as was every program in our agency. When I think about COVID, it is still and was a challenge, but there were also some opportunities that we saw. For example, in our training program, which we had in our conference center, upwards of 80 to 90 people in our big conference room a couple times a week, we had to pivot to doing it all online. And our training staff, along with our incredible tech team, did that so that we didn't lose a lot of time and we were able to offer trainings. And interestingly, our audience increased because people didn't have to drive to Alameda for a 3-hour training, meaning a half an hour to an hour both ways for in transit. They could look at it from their desk or from their home or look at it later because we now have a YouTube channel with the trainings there. Our fatherhood program invented dad discussions. Yeah. Every fourth Thursday at 6:30, still because dads couldn't come out and couldn't meet anywhere. So they were able to join online. Sometimes dads were joining from work at their lunch break because they needed a space for men to talk about what being a father figure was. We already talked about Neighbors Ready for School having to not do playgroups because people couldn't come anyway, but how do you do some things online or pivot to become navigators, pivot to distribute food, PPE, sanitizer. And then our ECE folks, God bless them as the essential workers, we partnered, for example, we'll talk about systems change and public partnership with social services to, in December or January at the Coliseum, handed out filters to over 550, air filters, to over 550 providers. So we were out there at 5 o'clock in the morning till 3 o'clock that Saturday with people driving through to pick up 2 air filters because that also helped them to stay open. So we literally expanded, had to learn new skills, either enhanced or made new partnerships because we had to hear what the community needed and however we could, if we could, step in and provide those resources, stand in the gap where there wasn't anything else.
I think one of our primary focuses has always been to reach families where they are, not just in their, physical space, but in their journey as parents and providers for their children. And this was a testament to that, right? We had the parent that was working at home, the parent that was in a multi-generational household, the parent that had to find childcare because they work as janitors at a hospital or.
And to still a shortage before and even a shortage now in mental health. That became such a need across the spectrum because just the fear of COVID, but then also people being at home together for extended period of times. And then there were behaviors that people were seeing, both in their homes and in their communities. And unfortunately, and I know you're going to talk about MHSA later, that is still a need in our communities, particularly when you're talking about culturally and linguistically affirming mental health providers. And so just a shout out to all those mental health clinicians who hung in there during COVID and are still addressing a lot of mental health issues now.
They addressed pre-COVID, COVID, and post-COVID. So I heard a couple of the strategies that you told me about, and one of them I took away was individuals. You retained more individuals from the trainings, like you had a bigger audience because they didn't have to do the travel time, correct?
Yes.
So would you say that then that strategy kind of changed, or the strategy of getting individuals actually in the building was not working, so then you pivoted to it actually working?
No, it was working.
it
I
was
mean, we had a
working.
built-in audience. Again, First Five is one of, if not the premier early childhood trainer in the county. So we have a robust training, particularly for entry-level trainers like child development, ASQ, ASQSE. But folks couldn't get to us, and they still needed that training. So we not only held our audience, the base, but we grew it because you could do it virtually. I think the question is going to be, as we open up our training center, hopefully soon, what will that audience be? Will they, because they've gotten used to being able to access it when they want, either live virtually or later through YouTube. So we're probably looking at a hybrid existence. And I think that's for so many folks is going to be, how do you pivot back? Is that something? How do you pivot to what the new normal is, given that folks have gotten used to certain ways of working, certain ways of getting training, certain ways of receiving services? And so how we're going to adjust to that is still to be seen. Mm-hmm.
So it was still made.
Oh, from the get-go. When you think about the best ways in which children regulate, consistency is at the top. Consistency and routine. And you take that away, you see the effects right away, right? You know, children aren't able to see their grandparents, or, now mom's home all the time. And, now I'm more plugged into the television or the screen because they don't know what to do. And they have they have to work from home or keep an income. And so, but there's no childcare spot. So it's visible from the get go. And one of the things that children also need is socialization.
Mhm.
Like, you need to be around other kids, and you didn't have access to that. And the playgroups had gone away, and the childcare centers, for the most part, had reduced availability. And it was visible then, and it's still present now. It's still something that lingers.
Carla, would you say socialization was a really big impact for children between 0 and 5, as far as, like, as you said, being around other kids? What was the negatives, and then how did first 5 pivot to make it sort of positive, or positive in general?
First 5 is good, Robert. I don't know if we were able to manage socialization. It just went away, to Beatrice's point. It
Oh,
was not
okay.
safe. And even if there were places like outdoors, so we tried to have people really look at their play spaces outdoors. But again, if you look at equity, and which some of our communities don't have outdoor spaces. If you're living in a densely populated, you know, apartment building or complex, or even your home with 2 or 3 families in it, there, and if there's no backyard. So that is something that, to Beatrice's point, we're still dealing with the aftermath of kids not being able to be around extended family, with their childcare groups, with friends or neighbors. And then because you're trusted adult, be it a parent, grandparent, tia, abuela, if they're stressed, then the child picks up on that too. So it's a double whammy in terms of lack of socialization. If my provider or my caretaker is there or not there, they're stressed because stuff is happening in the community, in the home. And so children pick up all that. They're sponges. And they also model behaviors. So we did not figure that one out. We're still, to Beatrice's point, trying to deal with the backlog of kids who have not been screened, who got screened and didn't get services, who didn't have childcare and now are getting it. And we're starting to pick up and see the impact of 3 years of living an altered existence.
Yeah, no, I remember being stuck in a room with my nephew. Oh my God. And then, as you said, seeing the aftermath, it's like, hey, I understand social cues, but do you understand social cues? Do you understand when someone's kind of irritated by you? Do you understand when you're actually disrespecting someone? Do you
Mhm.
understand when you're giving attitude? So I had to kind of retrain his thought process and retrain him how to essentially interact with other individuals. So, and that, oh my God, that was so difficult.
And if you
I
add a mask,
Yeah.
Mhm.
Oh, yeah.
right? Wearing
Yeah.
masks for 2, 3 years.
Yep.
So
That was actually going to be my next question. No, you're fine. So, as far as kids not being ready for kindergarten, what was that percentage like, and how has the impact been as far as kids not just being ready for school?
Well, I think it's worth mentioning that kindergarten readiness is like it's not just pre-K or just academics. That a lot of things go into a child being ready for kindergarten, and it can be what kind of resources they have in their neighborhood, whether it's safe, whether they have access to food, to a grocery store that sells fresh produce, whether they have access to healthcare and the recommended 3 developmental screenings before turning 3. It can be it's a lot more than just whether or not they were able to, like, go to pre-K or have access to childcare. So, the increased family stress and the lack of resources, people looking for basic needs, um, that all contributed to a drop in kindergarten readiness in Alameda County. Um, and we monitor the sort of the level of readiness through our biannual KRA, which is our kindergarten readiness assessment, and our most recent one shows a pretty significant drop in readiness among children based on what ECE providers and also parents have observed.
Now we've been talking about kids. Let's go to my parents. How are my parents struggling, and how are they struggling today from pre, mid, and post COVID?
You talk to them. You talk to them. Yeah. Okay.
Stress, I think, but that's been pre, mid, and post COVID. I think it was heightened a bit during COVID. You had limited resources, limited access to resources, and to what Carla was speaking of earlier, if parents are stressed, children are mimicking the stress, and it's a trickle-down effect. And doors are opening up, but now we're dealing with inequity, and the source of stress is still there. It's just shifted.
It's also important to note, and my colleagues have already said this, there were inequities before COVID, and we all know, because we've been in the county any amount of time, we can, to the zip code and census tract, know where the outcomes are worse and there are disparities. What COVID does was anybody who didn't know or didn't believe it was to bear it open, that where the COVID cases were the highest, where the caseload was highest, where the deaths were the highest, also overlay with the kids who have less access to some of the resources Caitlyn outlined. So it's scaffolded, it's layered, and it was amplified with COVID. And so now we find ourselves, and we keep saying post-COVID and new normal.
Yeah.
I don't know what those mean, because what was before wasn't great for some families.
Yeah, it was.
And in COVID, it got worse. And
Yep.
now they're still struggling to get back to what was normal before, which wasn't great.
Mhm.
So I think the question before all of us, when we think about programs, services, resources, data, and policy, is how do we get to the North Star, where every child gets to kindergarten ready to engage, which means then that every family in every community has what they need to give that child so that they can arrive to kindergarten ready. That was the question in 1998, and that's still the question 25 years later, that we are working toward putting together a continuum of comprehensive services and supports so that any child born in our county can have a reasonable hope that they can get to that kindergarten door, ready to thrive and achieve in whatever way they need to.
And I would also add to that, give families a new sense of hope, as in like, hey, your normal, like your pre-normal was not that great, but the future is a whole lot brighter than what it can be.
Let's hope.
Hopefully.
Yes.
Now, we talked about the programs that you held on to. We talked about the shifts. Did you guys add any new programs after COVID, or add any new implementations that is like a part of a new program?
I think we talked about adding new components.
Yeah.
I think, and Beatrice can talk to her division, which is a
Yeah.
new division in our agency. So
Yes,
you want
the
to speak to that?
pediatric care
Yeah.
coordination.
Ooh.
Yeah.
Yeah, so we've expanded a little bit. There's a contract with Alameda Alliance for Health and ensuring children attend their well child visits. And so we have currently 3.5 member outreach care coordinators that reach out to families and connect them to pediatric clinics so that they can attend their visits. What else do we have?
Dulce. You're taking
We have
Dulce?
Dulce.
Mhm. I know you're going to ask me the acronym.
Dulce, they
Developing understanding and legal
Legal-
coordination for everyone.
yes.
Yeah.
So we have a Dulce specialist over at Highland Pediatrics who supports families with children under 6 months old in ensuring they have access to legal counsel for anything from immigration to housing. Um, and then the centralized access point, we have 4 staff that 3 of them are bilingual Spanish English. One of them is bilingual Cantonese English. And they are on the phone every day, ensuring families can connect to resources in the community.
I think one of the changes that we've made with our Neighbors Ready for School strategy, again, our place strategy, is that because COVID so directly and intimately impacted them, is that we are engaging in a year-long facilitated planning process where they get to recalibrate now, having experienced the last 3+ years, what does neighborhood place-based work mean now to them? And so we are working with them with a consultant, Cities and Peoples, who also work with the City of Oakland, to determine what are the new priorities from what's the community saying they need and want. And then we working together with our partners to figure out how we do that. I just think organizationally, again, the commitment to data and policy. I mean, part of Caitlynn's role in terms of looking at our policy issues and the narrative that we can generate out of those policy requests, I think it's going to be really powerful. But our programs are still there. They're strong and stronger because of this experience. And I think there's more depth. But I also think it's even more critical that we move our agenda because we've seen what's happened to our families and communities the past few years. And so just committed to that equity statement, which we got a new equity statement and principles passed at our last commission meeting, which I think really does encapsulate our ongoing commitment to doing this work and doing it well for the people who need it most.
How is First Five? Because we talked about the changes and we talked about the additions. What is the final change, or how are you guys making sure children are more ready in regards to childcare as far as COVID now? Like, what does that look like?
I don't know if there are changes per se. I think our outreach has grown. Um, our community liaison team has now been able to go to community events to ensure more people are aware of the services offered through Help Me Grow and through First Five. Um, we still have our online portal families can reach us through. Um, More families are going to the pediatrician now. They're more in-person visits as opposed to telephone or video visits, and so our outreach to connect with families, I think, is reaching similar numbers than we were pre-pandemic, and yeah.
I think one of the areas that is everything that we do, I think, is exciting and innovative. But in our parent partnership strategy, we have, as the name would denote, really trying to work directly with parents to not just hear voice, but to have their voices be acted upon and have them at the table where possible to help make decisions and direct our work. But we are working with the 0 to 3 birth equity area because we also see that in terms of Black infant and maternal morbidity and mortality, the rates are 2 to 3 times higher than other populations. And so looking at partnerships, including with our public health department and others in the community, what do we do about that the 0 to 3 part? Before there's a child, how do we take care of mom? How do we take care of dad? So that we have the conditions set that once baby is born, that baby has a better chance of reaching their first birthday, which in some of our communities here in our county isn't a given, that a child will reach their first birthday. And if you just think about that, hopefully that's sobering for all of us. I think the other area, and again, there are many, but examples are really working really closely with our ECE providers, which both have talked about being first responders, essential workers, that there have been a couple of measures in the city of Oakland and in Alameda County that realizes the value and the critical need of having well-paid, well-resourced ECE providers and having the facilities then meet the needs of families who need to work, but to have access to quality childcare.
If you can get rid of any obstacle, any at all, like you could just snip it, what would that obstacle be and why?
I would I would probably get rid of the shortage of providers who are able to provide culturally appropriate services to families within the county. And that encompasses kind of a broad spectrum because I think of service providers as not just childcare providers, but speech therapists, mental health therapists, um, all across the board. I think that's right now, it's been uh,
Supply is not meeting
oh,
demand.
never. It never, and I don't feel it ever has. It's always, I feel like it's been a catch up game ever since I came onto First Five. It was people were sitting on a wait list to get mental health therapy for 2, 3 months or speech therapy 6 months. And it just, at times the lists get a little bit shorter, but they've never completely gone away. So I would have just an abundance of providers and and providers that
Yeah.
spoke all languages and, or had access to provide services to families in our county. There's 60 plus languages in Oakland Unified School District alone. It's It would be nice to have families be able to access those services.
I know of
Yeah.
14 that are not spoken
Mm-hmm.
naturally.
Right.
So yeah, that would be one too. Miss Carla. What would you snip?
I need a big old set of shears because I would need to snip poverty. Because if you look at what things are
Yeah,
affecting our
yeah.
kids and communities, I mean, these people outside in the campers, housing, healthcare, childcare, education. The poorer you are, the worse your outcomes are.
Mhm.
So you don't have any more data. You don't need any more policy to tell you. If you can address poverty, every kid, every family, every community is going to be okay. And so what do we do about that? We've had a war on poverty for how many years now?
I know.
50, 60, I don't know.
Well, now Oakland lifted the eviction moratorium. So
More of that.
more of that.
Medi-Cal redetermination.
Yeah.
Mhm.
Medi-Cal redetermination is back. And so families have to fill out lots of forms in order to keep qualifying.
Giant paperwork.
Yeah, and actually, like on the subject of Medi-Cal redetermination, we know we have data to show us that children 0 to 5 who lose their Medi-Cal, most of the time, it's not because their family makes too much money for them to qualify. It's because of failure to respond, which is kind of a catch-all term for like paperwork issues. So children are losing that insurance, and then they're losing those well child visits because they don't have a provider and they don't have health insurance. And so continuous eligibility for children 0 to 5 especially, but really all children is super important.
Carl, you knocked it right out of the park. She said poverty. You just snip it right down the middle.
Right.
And since we're on that topic, where do you guys see First Five in the next 5 years? As far as just, what do you guys think would be the end goal of a 5 year?
I don't know if we would ever reach an end goal, but I think going back to inching along to making a bit of an impact, you know, getting the kindergarten readiness numbers back up, um, implementing policy change that affects Medi-Cal redetermination or, you know,
hey, that one term does not mean people ain't responding. All right. It's just they can't fill out paperwork right now.
Yeah. Just, yeah. I think we all have this vision of what a first five or Alameda County utopia could look like. I, I don't know if we'll ever be there, but you'd hope that you get a little bit closer to it, right?
You, Caitlin, where you see first five, next 5 years?
I think First Five is at a really exciting. First Five is at a really exciting point in its history. We have a lot of expansion coming down the pike, and it's really exciting. So I think in 5 years, I certainly agree with Beatrice that I hope we're inching toward those utopian goals of every child being ready for kindergarten. I'm certainly hoping that we're going to see a rebound of those kindergarten readiness assessment numbers, and hopefully increased access to affordable childcare. I think that's always a goal, and I'm certainly hopeful that we'll continue working toward that.
Yeah, I agree with my colleagues. I think we move in 5-year increments realistically. Our strategic plan is 5 years. I think that's pretty much the horizon most people can look beyond, because it's a marathon. I think we talk about utopia. When I came to First Five, they said 5 to 7 years, we're done, we're good. We're going to make all these wonderful programs. The public systems are going to integrate them. Your work will be done and you'll be great. So again, 25 years in December. But I do think the momentum and what First Five has added to the health and social services sector in terms of really lifting up the needs of young children and their families has been excellent. And we need to continue to do that. Again, my cheers for poverty aside, I think looking at if we could just navigate families more humanely and make the system less complicated, if our public and community systems could talk with each other about what we do, who we serve, how long we could serve them, and have that be available to us, but also the community in language that people understand, and have the services people need when they need them, where they live, which is why place is so important. I think there are things that we can do that are reasonable and realistic. It's an issue of will and bandwidth, because our public system partners are so overwhelmed. They have a large mandate. And in some ways, we're more fortunate because our demographic of 0 to 5 is smaller, so we can really focus, but we have to attach to, collaborate with, partner with the larger systems. And so if we can just get closer and closer each year, each 5 years, to that utopic vision, I'd be happy, but we'll see. Yeah.
Now, this is on my end. I do a lot of reporting with Alameda County Behavioral Health. And if you guys want to learn more about more data or statistics regarding that 0 to 5, not just with First Five, but with all CBOs across the board, that information is actually on the MHSA 3-year plan that recently, it got updated back in April. So if you guys want to go look at that data, you guys are more than welcome to. And I encourage any of you viewers, if you want to learn more about what's happening in Alameda County as far as where funding is getting allocated as well, you can find that on the MHSA 3-year plan located at the ACMHSA website, and we'll link it down below.
Great. We'll do that.
Thank you guys so much for coming.
Thank you.
And I appreciated the conversation.
Thank you.
Thank you.